I acknowledge the partners and conference participants for coming together for this event to share experiences of health promotion during and beyond the COVID-19 pandemic. The pandemic disrupted lives, livelihoods, communities, and economies. We also know that it put health workers under extreme pressure. The conference objectives urge us to create synergies, build partnerships, and identify future actions that may contribute to policies. This conference, therefore, gives us an opportunity to reflect on some of the invaluable lessons we have learned as a country and as the world from the COVID-19 pandemic. It will also contribute to identifying sustainable practices that will build on our collective efforts of improving the well-being of our communities, especially vulnerable populations who have been impacted most. Today, we see encouraging signs of declining cases of COVID-19 globally, but we cannot forget the fragilities of our health system and the need to increase our resilience so that we can protect ourselves from potential disruptions that are still a reality. Pandemics such as COVID-19 can impede our efforts towards building a secure health system that brings our country closer to achieving universal health coverage. Central to this effort is to ensure that our most vulnerable communities, especially women and children, are protected, because even before the pandemic, inequalities of access have existed. These inequalities have been a key concern that have heightened the government's investment towards increasing health access for its populations. This is why it is critical that we share our lessons and learnings from this pandemic and align our recovery measures with long-term sustainable strategies. Most notable has been the important contribution of health promotion in tackling the challenge of the COVID-19 threat and its societal impact. Many of the containment measures that we adopted and relied upon to prevent the public and healthcare workers from getting infected and our health systems from being overwhelmed imply a change in behavior. Hand washing, wearing face masks, and social distancing are all forms of this change. In addition, health authorities have tried to enhance protective behavior amongst the public by issuing warnings and recommendations about this new virus. The victory of these measures provides impetus to turn the tools of health promotion for any future health crisis.